Joining us now is Dr. Rick Coker, live from his Smile studio, here to show us the results of the Smile Makeover he performed on a COVID-19 first responder. So welcome back, Dr. Coker, and tell us how the makeover went with Miss Dunn.
It went great. My laboratory technician, Bianca, did a fabulous job, and she worked all weekend to get this done in time, because normally it takes 2 weeks. With a fabulous team, with her being one of them, we got her done, and she's at the, as I understand it, she's at the salon getting her hair and makeup done as we speak. So the results were great, and I couldn't be happier.
Was there anything you or the rest of your team wish you had known before starting your procedure?
No, not really. I think everything went about as smoothly as you could expect. And of course, there were a lot of unknowns because we hadn't seen her before Thursday. So, it was like, okay, we didn't know what was, but there weren't any unforeseen issues to any significance that we couldn't work around. So we were fortunate because there's only so many things you can do while a patient is here. Sometimes you have to wait for healing, you have to do things like that, and we were fortunate. And she's just couldn't be happier. She loves her smile, and anybody in our profession that can make that big a difference in someone's life, you're just glad to do it. You can't afford to do it all day long, but the gratification that comes from making someone able to smile confidently is a great thing.
I bet. Now, of course, this was a very generous gift to Miss Dunn, but in a normal setting, what would this type of treatment or procedure have cost someone?
She probably would. It would be somewhere between, $17,000 to $20,000, just depending on what things had to be done. So you're looking at a fairly expensive redo, but obviously the profit wasn't the motive here. So. Everybody donated their time. The people that are doing her hair and makeup donated their time. The photographer donated her time. Bianca donated her time. And she actually did 2 sets of crowns, which she worked all weekend, and it was her anniversary weekend. So she's really a hero.
Aww. So will she need any follow-up care? And is this a permanent treatment?
Well, it kind of depends on what you define permanent, because like with your hair, a permanent lasts a couple of months, maybe. These should last her 20 plus years, and if they take care of them, I've been in practice 48 years, and I still see people with crowns we did 40-something years ago. But then it depends on how you take care of it. So to me, this is step 1 of her mouth rehabilitation. And so we got a lot of work done. She has some other teeth that need care. Obviously, she can't come here every time, but I have a friend not too far from her that's going to be willing to help her out, and she should just enter a regular dental program, get her teeth cleaned, and I think it's a great head start on her getting her mouth in perfect shape.
Last question, Dr. Coker. If anybody at home is listening and is like, I want that, I want a more confident smile, what's your advice to them?
Well, it'd be easy to say, give me a call, and that would be great. Just reach out. Nobody should feel self-confident or not inconfident. It's easy to fix. There's sometimes cases require different things, so it depends on the level of problem, but it can be fixed. That's what we do. So the technology has increased greatly. There's just a lot of different ways to make us smile great, and you find a dentist that's interested in that, then that can be done. And so it's not an insolvable problem.
Dr. Coker, thank you for joining us and taking the time to chat with us this morning.
Well, I appreciate you. Thank you so much.
You're so welcome.